Look at here. To this part. Okay. This is cross cerebri. They are cross cerebri. Okay. It is optic chiasma. It is hypophyseal gland, and these two parts are mammillary body. Okay.
Infundibulum, doctor.
What?
Infundibulum should be also here.
Infundibulum, yes. Infundibulum is just here. This part is infundibulum. Okay, here. Infundibulum hanging hypophyseal fossa. Okay. They are mammillary body here. They are mammillary body. It is interpeduncular fossa. Interpeduncular fossa is located between crus cerebri, optic chiasma, and optic tract. Okay, this part is interpeduncular fossa.
Between two peduncles?
Yes, interpeduncular. It is located between two crus cerebri. Crus cerebri is some part of cerebral peduncle. Yes. Laterally, cerebral peduncle. Anteriorly, optic chiasma, and also superiorly and laterally, no, optic tract. Okay, and the structures which are located in the interpeduncular fossa, which they are depend to the midbrain. Okay, the first in the depths of this area. Look at here. We have posterior perforated substance. Okay, in the depths of this area. Posterior perforated substance is located below to mammillary body. Okay, look at here, it is mammillary body. It is posterior perforated substance. Okay, and also we have a nerve which emerge in the inferior part of the interpeduncular fossa. Which nerve? Cranial nerve number 3, oculomotor nerve. Here we have oculomotor nerve. Oculomotor nerve makes lateral adjacence for the midbrain because it travels laterally. Okay, look at here at this area. Look at to oculomotor. Look at to. Excuse me. Here, look at here. Trochlear nerve, which emerge in the posterior part. Okay, it is trochlear nerve. Makes lateral adjacence. Can you see? Okay, look at here. Look at here. It is trochlear nerve. It makes lateral adjacence for the midbrain and travel anteriorly to arrive to this part. Here we have oculomotor. Here is trochlear. Okay. The lateral adjacency. What are the lateral adjacencies? The first, as you can see here, we have temporal lobe. Inferior to temporal lobe here is inferior temporal gyrus. Okay, inferior temporal gyrus makes lateral adjacence for the midbrain. Also, trochlear nerve makes lateral adjacence. Okay, lateral adjacency. Also, another adjacency are the basilar vein, posterior basilar vein, or the posterior cerebral artery, which as they are not seen in this moulage. Posterior part. Go to posterior part. Look at here. The first, look at here. What is this sulcus? Yes, here we have basilar, sulcus, and you know about this nerve, yes? From medial to lateral in the pontomedullary sulcus. Abducent, facial, vestibulo-cochlear. Okay? Here, facial has two parts. In the medial part we have motor part. Laterally we have sensory. Sensory is named intermediate because it is located between motor part and vestibulo-cochlear. Very good. And also in the lateral surface of the pons we have trigeminal nerve. Very good. Go to posterior. Look at here. In the posterior surface, okay, as you can see, posterior surface of the pons contribute to makes superior part of the floor of fourth ventricle. And you know that in the floor of fourth ventricle, the first, we have a sulcus, posterior median sulcus. Lateral to this sulcus, we have this eminence. Which nerve makes this eminence? Facial nerve. So this is named facial colliculus. Okay? This eminence is named facial colliculus. In the posterior surface of the midbrain, the midbrain in the posterior surface, as you can see, the most bulging part are corpora quadrigemina. Two superior colliculus and two inferior colliculus. Inferior colliculus connect to inferior brachium and then connect to medial geniculate body. Medial geniculate body is some part of? No, thalamus. Medial geniculate body is some part of thalamus. Okay? Yes. Look at here. Inferior colliculus connect to inferior brachium and inferior brachium connect to medial geniculate body is not seen here. It is some part of the thalamus. Superior colliculus. Look at here. Superior colliculus connects to superior brachium and then connects to lateral geniculate body. Okay. Another structure. Look at this nerve. Trochlear nerve. It is the only nerve which emerges in posterior surface of midbrain. It is trochlear nerve. Okay. About the adjacency. Look at here. In the midline, okay, in the midline from inferior to superior, the most inferior part here, when the superior medullary velum connects to this area is named superior medullary frenulum. Okay, this part, look at here, this part is frenulum of superior velum. Okay, this part is some part of superior medullary velum because it covers and makes the roof of the fourth ventricle. In the midline and superior part, you can see this gland, pineal gland. Okay, pineal gland also is some part of diencephalon. Okay, pineal gland is some part of diencephalon, and here is thalamus. The posterior part of thalamus is named pulvinar. Okay, pulvinar of thalamus also makes posterior adjacency for the midbrain. It is midbrain, yes, it is midbrain. In the midline, the adjacency of the midbrain are pineal gland. Here is pineal gland, and here is pulvinar of thalamus. Okay. Another part here. It is some part of corpus callosum. Okay, look at here. Corpus callosum connect two cerebral hemisphere together. Okay, imagine that it is, my finger is corpus callosum. It is splenium of corpus callosum. Here is body of corpus callosum. Here is genu of corpus callosum. Okay, splenium of corpus callosum also makes posterior adjacency for the midbrain. Okay, all of them posterior or posterior adjacency. Splenium of corpus callosum, here, pineal body, and pulvinar of thalamus. Okay, and the structure which are related to the same midbrain are inferior colliculus, superior colliculus, inferior brachium, and superior brachium. Okay. And also here we have trochlear nerve. It is the structures which you can see here. At this area. Look at here. It is thalamus. Okay, it is thalamus. It is anterior part. It is posterior part. Yes. Thalamus has two bodies. Medial geniculate body, lateral geniculate body. They are seen in the posterolateral view. Okay, so it is anterior, it is posterolateral view. Look at this part. It is pulvinar. posterior surface of thalamus is named pulvinar. Okay, pulvinar makes posterior adjacency for midbrain. In the midline here, pineal body. Okay, here we have pineal body, which is posterior adjacent for the midbrain. Laterally, thalamus makes geniculate body. Okay, look at here. Medial and lateral geniculate body. They are geniculate body of thalamus. Geniculate body connect to midbrain. Look at here. Inferior brachium, superior brachium. Okay? Okay, it is the structures of the pons and midbrain.